Welcome to this episode of Ask a Neurologist. This is Rabia Akram. I'm a medical doctor and entrepreneur and your host of the Ask a Neurologist podcast. Today, I'm honored and thrilled to have a very special guest at the studio here with me. He is a medical doctor, a German family physician, and a pioneer of natural medicine. He is also the founder of a therapy concept, a complementary cancer therapy approach called the Medico-Natura concept against cancer. And he's the co-author of this book, which is about this therapy concept. And this book is full of actual patient cases and interviews with the author himself. And without further ado, I welcome you to the Ask a Neurologist podcast, Dr. Reinhard Probst. Welcome to Ask a Neurologist.
Thank you. Thank you for having me.
As I already mentioned, your main area of work is natural medicine, but you also do some very interesting stuff with cancer therapy. So please tell us a little bit about your work.
Okay, it's a broad field to talk about my work because I use many things. Mm-hmm. When I started with homeopathy. Mm-hmm. So, and then I found out that you cannot treat everything or cure everything with homeopathy.
Right.
And I was in a clinic, in a naturopathic clinic,
okay,
close to Munich.
Mm-hmm.
And I learned a lot of things like acupuncture, chirotherapy, mm-hmm. nutrition, hypnosis, mm-hmm. everything. So, mm-hmm. and then afterwards I was trained in so many fields and things. So mm-hmm. I tried to help patients. So.
You try to help patients.
Yes.
This is also something, when I read your book, it's something that came up over and over. Your patients say you're a doctor who genuinely cares for his patients, and you have helped many patients, helped them change their lives, especially patients with chronic conditions and yes. terminal illness such as cancer. We will come to all that. I have a lot of interesting questions for you. But let's start a little bit with what got you into natural medicine? Why did you decide to do natural medicine and not the conventional? Or you combine both, so why did you decide to combine natural medicine with conventional medicine?
First of all, I wanted to become a musician.
A musician?
Because I'm
okay.
a singer-songwriter.
Yes.
I'm a very creative person. But then I decided, I wasn't discovered, nobody mm-hmm. Saw my talent.
Okay.
Unfortunately, so my second choice was always becoming a doctor because both my parents were doctors and also my grandfather mm-hmm. were a doctor. So the pressure of the family was very high.
Right.
But I hated the normal approach, the school medicine approach, mm-hmm. because okay. It seemed to me. In a way inhuman.
Okay.
How they treat the patients like machines.
Machines, okay. You talk about patients who are terminally ill, who are dying.
No, in general. So,
in general.
And I worked then with my civilian service. Mm-hmm. So we had, instead of the army, we had a civilian service. Mm-hmm. I was in the hospital, in the mm-hmm. operation room. Mm-hmm. And for me it was really cruel mm-hmm. how they treated the
okay.
patients.
Okay, you didn't like
how they saw the patient, as I told you, like a machine.
Okay.
To substitute something, to put something out, to cut something away,
okay.
and then you're healthy.
Okay, so you didn't like the compartmentalizing of treatment,
yes.
diseases and treatments, which is very common in conventional
yeah.
medicine. You wanted to take
approach.
a more different approach to it. Okay.
And one of the surgeons was actually a homeopath. Mm-hmm. So a trained homeopath. It was very unusual.
For a surgeon
yes,
to be a trained homeopath, right? That's unusual, yes.
And he was very convinced of homeopathy, and so I bought the only available book in that bookstore in that city I worked was only one book about homeopathy. So I bought this book and was very intrigued. It was extremely fascinating for me. And then this doctor said, well, you can just give homeopathic remedies to persons, even with not being a doctor, just try it. And so I tried it with the little pills and I was very fascinated. And therefore I studied medicine.
Okay, that's where the fascination started.
So school medicine was more or less my enemy when I started medicine. And then over the years I recognized that school medicine is very important as well.
It's important, yes. You learn the basic theories, the body's functionings, and you use this together with your knowledge of natural medicine to come into something unique.
Yes.
Okay, that's wonderful. So, so this is the background from which you're coming. So, talking about how this developed into what you're doing now, because today you're a very successful, you're a very renowned physician in the field of natural medicine. You're countrywide one of the leading physicians who is doing this stuff. So, tell us your journey from being there, the civil service student, to where you are today. Did you do training at hospitals? How did you get from there to here?
Yeah, after my study in Munich, I studied medicine in Munich. I was a physician as I told you, in a hospital close to Munich for naturopathy, a specialized clinic. And so I came there with a huge knowledge of homeopathy. And they said, oh, it's good, it's okay if you know something about, many things about homeopathy, but you have to acupuncture every patient. So, okay, so I tried to learn, so I more or less was forced to acupuncture, and then I found out, wow, it's helping the patient.
Okay.
So, one of my first patients was a patient with migraine, for example. And after my acupuncture, it was completely gone.
That's very fascinating because I am coming from the field of neurology and I know migraine patients, it's very hard to treat them, right?
Yeah.
So that's very fascinating. We'll be coming back to acupuncture and the stuff that you do. But for now, so you worked at that clinic for natural medicine for some years, and then you were also teaching at the Technical University of Munich. You did part of your training there, and then you started your private.
The TU Munich was a partner of our clinic. They did studies and surveys on our clinic for neurodermatitis patients, for example. And then they organized education for physicians in naturopathy. So if you want to become a certified doctor in naturopathy, you have to make education program, and
so you were teaching doctors.
I was one of the teaching doctors with them in many fields. So.
Okay.
And when I left the clinic, so I had made some career in the clinic. I was then. In the end, I was chief resident of my clinic.
You mean chief of the department?
Yes.
You don't mean chief register as in
of the hospital.
We had yes.
We had 3 hospitals.
Yes.
And I was on one of the hospitals. I was
the chief of that department of
naturopathy.
Natural medicine.
And then I founded my own practice. On the one hand, on the other hand, I was coach for cancer patients, for health training for cancer patients for the university. So I had 2 jobs. And therefore I was very into that cancer theme.
Yes.
And before I had a very broad field, many patients with different diseases. So, but then it was the focus lay more or less on the cancer patients.
Okay. That's very fascinating. So, So that was your the process that brought you from there to where you are today. So tell us about what you're doing today. You have a private practice
Yes.
in Munich, and you treat patients, lots of cancer patients who are very ill, who are hopeless. I have read in your book and also from testimonials from patients who say, okay, this really gave me hope, this really changed my life. So this is one thing you do, but on the other hand, you also treat patients with other diseases,
Yes.
not only cancer. So you're a family physician, but your focus lies on cancer.
Yes, but I
Right.
have many patients with chronic diseases
With
normally.
chronic diseases.
Yeah.
Okay, we want to know all about that. So let's start a little bit with what is your specialty among your other works, cancer. So tell us about the kind of approaches you use in cancer, and also about what kinds of cancer you treat.
Okay, maybe I can explain it more sufficiently with the history with my own background. I mean, I started with the cancer patients. I came in touch in this health training program, so they came to my practice, and they all got chemotherapy and were treated with conventional medicine. So my approach, my therapy the focus was very on the side effects. So to overcome the side effects. For example, against nausea, acupuncture is extremely helpful.
Okay.
And more helpful than any school medicine substance. This was, or I did vitamin C infusions, for example, for the energy level, or I used organ products like thymospeptides for the immune system, for the energy level. And then came patients after normal conventional therapy in a now stable situation with breast cancer patients after operation, chemotherapy, anti-hormones, radiation, and then they wanted to stay healthy. So I tried to keep them healthy with a lot of things. And then I found out, for example, that vitamin C was a substance that can kill cancer cells in the bloodstream. So there are laboratories that measure cancer cells in the bloodstream, circulating cancer cells, and I found out, okay, I can reduce cancer cells in the bloodstream with high dosages of vitamin C as infusions.
Okay.
So therefore I knew, okay, this is an interesting substance. But I found out if I give it to cancer patients with growing cancer, the effect on the growing cancer was very low.
Okay.
So then I'm a very creative, since I'm a musician, I'm a composer, I'm a very creative person.
Yeah.
So I tried many things. And I came across a substance. This is highly disputed. It's called amygdalin. It's claimed to be toxic, but I found out it's not toxic, not at all. And it was a little bit difficult to use that substance because actually it's forbidden in Germany to use it on the one hand. On the other hand, I'm a physician and I have a constitutional right, and my constitutional right is to treat my patients with every substance I want to treat them. So we have two concurring laws. So. And so I decided to use that substance, amygdalin, and I actually cured one patient with metastasized cancer completely with that substance. So I found the next substance. Then I treated a lot with that substance, for example. Then from this substance I came to the next substance. So I discovered many substances. I used a lot of things and found out, okay, only a part of it is actually working. And the not working substances I cut away. So I only kept the working, the efficient substances. So this was my approach.
So this was the path through which one by one you came up with the concept of your concept, which is also of the main topic of this book, the Medico Natura concept. So this is how it evolved, right?
Yes.
You tried out different substances and you saw what worked with your patients and what did not work, right? So of one follow-up question on this one, did you also see any, because in conventional medicine we see many times a lot of harm being done by many of the treatment approaches. Patients, okay, they have cancer remission a little bit, but they also lose a lot of energy, lose a lot of vitality. So some harm is also done. So in your approach, the substances which you have tried out, have you had any negative experiences? Has anything bad happened? Rarely.
So we physicians, we had to do an oath, and the oath of Hippocrates, who lived 2,000 years ago. And one important sentence is to prevent the patient of being harmed.
Yes.
This is the main principle of medicine. So if I give the patient chemotherapy, radiation, operation, or cortisone or something, I actually actually harmed the patient.
Okay.
So for me, always a main thing was to prevent harm. And so everything I use normally are substances with no or very little side effects.
Okay. Okay.
So this is very important for me, not to torture my patients. I mean, they have progressed diseases, they have fears, they have pains, they are exhausted, weak, and so I don't want to harm them. I want to that they benefit from my therapies. It's very important.
Yeah. So not to cause any harm, do good if possible without causing any harm. That's the main idea, right? Okay. I love that. So let's. So this is how you came to the concept that you use, and we know that natural medicine is very up and coming. This is the future, actually, if you ask me, because many of these substances which are successfully being used in cases as a complementary approach together with classic conventional medicine. Some of these things will be more, the more studies will be done on these, and once we get to know more about these substances, they will probably be used more often. So in a way, there is a lot of future for natural medicine because it causes, like you already said, it causes less harm but does more good, right? So in addition to the substances you talked about, what do you think has the potential among the therapies that you use, the natural therapies? Which therapy has the potential to get very big in the future? Because you have seen it working and there are more studies being done. What do you think it has that kind of a potential?
It's extremely difficult for natural substances to become a big player in the market because you need money to do this. And if a pharma company wants to investigate, wants to spend money on substances, they must invent the substance. So a natural substance has normally no chance. So you need somebody who gives a lot of money. A billionaire or something, Bill Gates or whoever, who said, okay, let's do a study, for example, with curcumin. Curcumin is one of the most important substances for me against cancer and against other diseases like inflammatory diseases. Very interesting substance. So for me, it's a shame that there are no big studies with curcumin.
Right.
Because almost everybody who uses curcumin as infusion see that it has a very strong effect. but it's very difficult
Okay,
to get this into school medicine.
Right, because of lack of interest from the big pharma
Yes.
industries. Okay, so that's one point. Other than that, when you see, you talked about curcumin.
Yes.
It has very high potential of being of use to patients in the future. What other substance or therapy approach methods that you use do you see helping patients the most?
It's always the combination, but as I told you, some natural substances like vitamin C, like amygdaline, like artisanate, it's from the Chinese medicine. It's used in the Chinese medicine as well. It's a very interesting substance against malaria, for example.
Ah, okay.
So 5 years ago, I think 5 years ago, a group got the Nobel Prize for the research for studying the effects of artisanate on malaria.
Okay.
But it also is very important substance against cancer.
Okay.
Because the main feature to go into the cell to react with iron is something that is both in cancer cells and in infected plasma cells, erythrocytes, red blood cells from the malaria parasite. So it's very important substance as well. We have other substances like dichloroacetate, which blocks the sugar breakdown in cancer cells, for example. So there are many interesting.
Tell us a bit about dichloroacetate. What does it do? How does it work? Without being too
okay, I try to make it simple.
Right.
So cancer cells need a lot of sugar because normally the sugar degradation in the cell is corrupt. So normally if a cell has sugar, the sugar is broken down into CO2 and water. So this is what we are when we are in our respiratory work. We breathe it out, CO2. So
Right.
it's
Right.
In the end it comes from sugar, this CO2.
The CO2.
So and it's the last part of the metabolism is in the mitochondria, and then normally they don't work in cancer cells. So therefore the cancer cell has to do fermentation.
Okay.
So it's only a part of this breakdown of the degradation of glucose. It goes only to the milky acid. So, and the DCA turns the molecule which would be the milky acid into another substance. Another substance which goes to the respiratory energy chain into the mitochondria, and then it's blocked.
Okay.
So
all right.
Was it simple enough?
For me, it was understandable because I'm also coming from the field of medicine, but that's a very good explanation. Thank you. Okay. All right. Without going further very in depth into the mechanisms, we will maybe continue talking in the direction of the different approaches. So hyperthermia is one approach that you use. Tell us a little bit about it.
So in hyperthermia we use electrodes, and between these electrodes is created an electric field. And this electric field has many effects. It heats up the tissue in the center of the body. Normally if you heat the body up, you begin to sweating and the blood vessels are becoming bigger, the veins, so the body does everything to prevent the body from overheating. So there's a trick only with the electric field that you can focus the heat into the center of the body. So the effect on the cancer cell is very interesting because cancer cells are very sensitive to heat because they cannot build something it's called heat shock proteins. So normal cells build as protection, a protein.
Heat shock protein.
Heat shock protein, yes. Built as a protection shield of proteins. Normally, cancer cells are very low in that heat shock proteins. Okay. This is one effect. The other effect is we have more circulation in the cancer. So if you give substances like infusions, we have more of the substances into the cancer. Okay. And then the blood vessels in the cancer are not flexible normally, because the cancer is fast growing, so even the blood vessels are not very well developed. So the heat is blocked in the cancer. And then on the other hand, the healthy tissue around the cancer is the circulation is higher, you have more oxygen, the immune system is stimulated with the heat, and the heat shock proteins built by the healthy tissue stimulates the immune system, for example. Okay. So, and we know from research that the electric field also harms the cancer cell. Okay. So we have many good effects, benefits against cancer cells without harming the healthy tissue. Right. In contrary. Right. So this is, therefore I call it the good sister of bad radiotherapy. Right. Because with radiotherapy you destroy everything.
So hyperthermia sounds to be very, very interesting. It's absolutely fascinating the way it works. Is there any way that this method, hyperthermia, can be used to prevent cancer? When you use it on healthy people who don't have cancer, does it have any positive effects?
Theoretically, yes, but you have to know where the cancer should appear. Because I use regional hyperthermia. Okay. So I could use this on the lungs, on the breast, on the liver, on wherever. Right. Because the temperature should go high to 42 degrees. 42 degrees Celsius, so 42 degrees. And if you do it of the whole body, it's only possible with sedation. Okay. It's too hot. Too hot. So there are other forms from hypothermia, like with lower temperatures. Maybe there is some effect concerning cancer. I don't know in the prevention of cancer, but normally it's. I wouldn't use it like
okay, this. It's not yet used to prevent cancer in any way. Okay.
But you can, with hypothermia, you can treat different diseases like asthma, like inflammation, chronic inflammation, colitis.
Local hyperthermia. Yes. Okay, that's very fascinating. Absolutely, I really like that therapy method. So I read in your book you also use curcumin, a compound called curcumin, a lot. Maybe tell us a little bit about that.
It's a very for me one of the most important substances. Curcumin comes from the turmeric plant.
Turmeric.
Yes. Okay. The Latin name is curcuma longa, therefore the name curcumin. It's a single substance, a single molecule out of the whole plant. Okay. It consists of 100,000 or millions different molecules and substances, but this one is extremely important. Okay. It's like a miracle because it blocks, at least in the laboratory, more than 100 metabolic pathways of the cancer cell. So not only one. If you compare it to a chemotherapy,
which is targeted.
Chemo agent only is always one pathway. Right. So it blocks more than 100. This is very fascinating. For example, the R2 receptor. The HER2 receptor is very important for breast cancer patients. One infusion with the Herceptin, that's the medicine against it, costs 2,000 euro, for example.
Yes.
Or the RGFR receptor, there's one substance, Avastin, It's also used in breast cancer. Costs 4,000 euro. Curcumin costs only 150 to 250 euros.
Okay.
So it's a very too cheap.
Okay.
I would say it's too cheap.
Okay, but it's highly effective. You have had good experience.
It's highly
with
effective.
It. Okay.
So I always compare it, for example, if you want to destroy a city. So if you throw a bomb on a very important city, in Munich we would say the middle ring.
Yeah.
Yes, you can create a lot of confusion, but it's only one street.
Yeah.
It will take, I don't know, a couple of weeks and then everything is okay again. But if you block 100 different streets in Munich, this is a very nasty thing. So
yes,
therefore,
that's what curcumin does.
Curcumin is a completely harmless substance. It's a non-toxic substance. So therefore, for me, it's an extremely important thing.
Okay, amazing. So I was also reading about albumin carrier therapy in your book. Maybe tell us a little bit about that.
Also a very important substance, and the last step to create my method. Albumin is a transporting protein. It transports substances from one tissue to the other tissue via lymphatic system or blood vessels. And we know that cancer patients with progressed diseases have a very low albumin level. Why is that?
Yeah.
Because the cancer feeds on albumin.
Cancer feeds on albumin.
They destroy the albumin
Yeah.
to make sugar out of it.
Yeah.
So that's possible.
Yeah.
And so the idea in the German Cancer Research Center in Heidelberg 30 years ago was, why don't we attach a substance that is toxic for tumor cells on the albumin?
Okay.
And therefore it's like the albumin brings the substance in the tumor tissue, and only in the tumor tissue will be released this substance. So, and they tried it with a molecule. It's called methotrexate.
Yeah.
Methotrexate is
methotrexate. Yeah.
a substance. It has a highly anti-inflammatory potential and works against cancer cells. And now it's only released in cancer tissue. That means this substance, as a whole, albumin plus methotrexate, is completely non-toxic for healthy tissue.
Okay.
It only works in cancer tissue.
Okay.
And by connecting it to the albumin, the effect lasts for 2 to 3 weeks. If you normally have one molecule of methotrexate, after 3-4 hours, it's gone.
Yeah.
So this is a very fascinating substance as well.
So you use albumin carrier together with
curcumin?
usual, together with curcumin, and you attach the albumin carrier. I mean, you use the albumin carrier together with other chemotherapies like methotrexate and other chemotherapies, so that the therapy comes into the tumor cell itself. If I understand it correctly.
It's made from laboratories or pharmacy stores. I cannot do it myself.
Right.
Yeah, it's really complicated to. They say they glue it on the albumin, so it's a difficult procedure to get it actually to the albumin. So I use the pre-prepared substance, of course, in my practice. So I don't stir it in my kitchen or something.
Okay, right. Okay, that's amazing.
But it has it's for the future. It's very important because you can attach other substances on the albumin. For example, we're trying to use curcumin. Yeah. A curcumin albumin. Compound.
Right, that would work wonderfully, right?
Extremely interesting.
Has this been done?
Yeah, there are researchers. So there is a foundation, Albumin Carrier Foundation, and they support research in this area.
Okay.
And one prototype of curcumin, albumin is ready, and I'm very curious to use it.
Absolutely. Absolutely. This is very fascinating. So we will touch one last method in the cancer therapy scenario that you're using. It's called the insulin potentiation therapy.
Yes.
Please tell us a bit about that.
So, as I told you before, cancer cells have many, need a lot of sugar, and therefore they have many insulin receptors. So normally insulin bring the sugar into the cells.
Into the cell.
Because, as I told you, the metabolism of sugar is corrupt in the cancer cell. They need more sugar, much more sugar, and therefore there are many insulin receptors on the surface. What I didn't know before I practiced this medicine was that insulin is not only responsible for sugar, it's also responsible that other substances go into the cancer or into the cells, like proteins, for example. So the whole cell surface is becoming more penetrable if the insulin is attached to the receptor. And so the idea was to give insulin, and then it's connected to the receptor, then the cell becomes more penetrable, more sensitive, therefore. And the other effect of insulin is that this cell is beginning to divide itself. And only dividing cells are sensitive to substances.
So when you give insulin to it, the cell divides?
Yes.
Okay.
So this is the effect if you eat a lot of sweet things, or you drink a lot of soft drinks, for example. It enhances cancer growth.
Okay.
So, but we give insulin instead, but without glucose or something like this. But instead of glucose, we give only 20% dosage of a chemotherapy, chemo agent. And normally with 20%, you don't have any side effects.
Okay, so low-dose chemotherapy.
Low-dose chemotherapy. We, for example, one of the most important targets, side effects of chemotherapy is attacking the white blood cells. But in the white blood cell is our immune system. So our immune system is definitely destroyed with chemotherapy. So with the insulin potentiation therapy with only 20%, we see normal white blood cells.
Right, normal white blood cells. So this was very interesting that you use insulin so that the chemotherapy would get into the cells, right? So is there any, you talked about insulin also when healthy individuals are eating lots of sugar, it's also sort of creating insulin resistance and stuff like that, right? So is there any, and you also said it sort of promotes cancer growth in individuals with cancer. Does this have any implication on healthy people?
Yes, of course.
Is there any evidence that it also does in healthy individuals?
Yeah, there is some evidence that high intake of carbohydrates can create cancer.
Okay, with the insulin
it's
mechanism.
It's
one of the things. Okay.
Risk factor.
One risk factor. So you suggest, we will come to prevention on cancer and all that stuff. So we'll leave that question for then. We talked about the methods you generally use in your cancer treatments and cancer therapy. Let's come now to cancer prevention, like we already said. So what do you think in today's society? We already talked about carbohydrates. Most diet consists of a lot of carbohydrate. It's very hard to find anything to eat. And when you go to a restaurant or in your hospital cafeteria to find anything which has low carbohydrate. So do you think this is a problem, the normal level of carbohydrate that we're taking in supposedly healthy food every day, or does it become problematic when we start taking extra sugar and start eating lots and lots of sweets and chocolates? So please tell us a little bit about
that. I mean, the last thing is the main thing, that the people tend to drink soft drinks with a lot of sugar, or eating sweet things, cakes and whatever. Right. This is, of course, it's a problem, but the main problem is that we don't exercise. Okay. We are sitting here around, for example, right. And instead of doing something, so if you eat carbohydrates, you have to do something. You have to burn the carbohydrates. So this is one thing, but so the focus, we know a lot about exercising. The focus is physical exercises prevents cancer. This is more important than any diet. So I wouldn't say that low carb diet prevents cancer. It's not clear yet. Okay. Because there are other factors we don't know. A new insight is, for example, that there is one amino acid, it's called methionine. Methionine can create probably cancer or other diseases. And it's very high in meat, for example. So we don't know enough, but what we know is physical exercise helps a lot. Doing sports helps a lot. Doing sports helps a lot, okay. Okay, so you talked a little bit about, you just mentioned methionine is found in meat. So what's your take on this? Is more a plant-based diet and eating less meat healthy for preventing cancer? So I tried a lot with diets. So I tormented my poor cancer patients with a lot of diets, and then the only diet I saw an effect was actually the ketogenic diet with a very low input on carbohydrates. But it only, the effect was only in the beginning of the therapy. So I saw for 2 or 3 weeks that tumor markers went down, but then began to rise again. Okay. Why is that? Because you have, in cancer cells, you have more or less an evolution in a very fast time. So the cancer cells are therefore very tricky. They are very quick in searching other food resources. So. And then they use proteins, for example. They can use proteins like I told you, albumin could be one substance, and they use the albumin for nutrition. So you cannot starve, unfortunately, you cannot starve cancer with a certain diet. So therefore, I switched to a diet that is respectful for the own body and for the nature. So for me, respect and love is very important. If you eat something, I don't want to eat meat of a tortured animal, for example. And in my understanding, it cannot be healthy for a cancer patient to eat such stuff like tormented animals, for example. So therefore, I think it has to be organic food. We now need that organic food is more healthy. It has to respect the environment. So why should we eat here in Germany mangoes, for example, that have to travel around the whole world?
Okay, so you take into consideration also the health of the planet and the health of other animals, right? That's really wonderful. I absolutely love that. Because
I can explain you why I'm thinking about that. Cancer has to do with information. We only see the body and how does the body create the cancer, but it always has to do with information. Information. Negative information. Okay. So I can explain you why. Because every cell in the body has the same DNA. You know that. But it's remarkable because even if you have the same DNA in the eye, in the nose, in the mouth, it looks completely different, you know? So the cancer cell has the same DNA. Why does it turn to a cancer cell? They need some information, some wrong information. And so we are on a concept, a well-known scientist is Rupert Sheldrake, for example, who created the theme of morphogenetic fields. So that you have an information field that influences the body.
Okay.
But therefore, not only substances are important, like infusions. For me, the mental health, overcoming traumas in cancer patients are extremely important.
Okay. So yeah, right. So that's you also work with the theory of the entire process of cancer and disease being one system of information which is also coming from outside. So this is the theory with which you work.
Yeah, it's
right?
always, you have always an inner reason for becoming cancer.
Right,
There's always
right.
a specific inner trauma. At least I found it out.
Right, absolutely. This is very interesting. So I will go back a little bit to the topic from which we came to this area, which is how healthy individuals can prevent cancer. And you were talking about how particular kinds of diet, right? Particular kinds of diet, and we talked about the importance of the environment, taking into consideration environmental factors and eating a diet which is also healthy for the planet and all that. This is absolutely fascinating. What I would also really like to know from you is you once mentioned the ketogenic diet you're using with your patients. So do you think it's also in any way good for healthy individuals to go into such kind of a diet as a ketogenic diet?
No, as I told you, the effect was too small.
Was too small in cancer patients.
Yes.
I want to know about in cancer patients, because cancer cells are very tricky to treat, right? We want to know what does this kind of a diet have any good effect in preventing cancer in healthy people?
So my ethics are really to be respectful.
Right.
So we cannot, what we are doing is destroying our planet. And if you use a ketogenic diet, the imprint, the CO2 level is extremely high. If the CO2 level, if you eat a lot of meat, for example, you have a very high CO2 level in the atmosphere. You create a lot of CO2. I wouldn't recommend it.
Okay, but isn't a ketogenic diet also eating lots of fat and not a moderate amount of protein?
Yeah, you have to get your energy, or can you get your energy of fat, of proteins, and carbohydrates.
Yeah.
Of course, you can lower down the carbohydrates to a very small amount, but then you need something with proteins. Of course, you can eat soya or soy food, tofu or something.
Yeah.
But it's the end, more or less. Then you have meat, fish.
Yeah. So you think it's not sustainable also for the planet to sustain in such kind of a
and that's
diet?
an important factor.
These are important factors, yes, absolutely. So I will ask you one last question on diet, right? So you think a ketogenic diet is healthy but not sustainable also for the planet. What do you think, in your view, is a diet which is healthy for normal individuals, healthy individuals, to prevent cancer, and which is also sustainable for the planet?
So I wouldn't say that a ketogenic diet is healthy.
Okay.
I'm not convinced anymore of that.
Okay.
And you cannot split apart the nutrition from exercising.
Okay.
So if you eat a lot of things, and we are inclined to eat more that we spend on energy, of course you're creating trouble. In the body. So it must be the same amount you eat. You have to some way to exercise, to work, so something like this.
Yeah.
And then, as I told you, organic food would be good for us,
okay,
for nature. local products.
Local products.
Of course.
Yeah.
As I said, I think that everything what surrounds us has influence. So if you eat something that is from a fermented element, it influences negatively. So it's my philosophy.
Okay, okay. It's
So
a wonderful
be
philosophy.
respectful.
Yes. So you were talking about this system of information which is also coming from other stuff, other food that you're eating, from the environment, which affects health and mental well-being, and also can lead to, by affecting your DNA and also your internal system, it can lead to disease, it can affect the way you develop as a person. So please tell us a little more about that.
So, as I have many cancer patients, and I'm not talking with them only for 5 minutes, like a normal doctor does,
right?
but 1 hour.
Right.
So I was always interested in the background. A standard question would be: do you have any idea why do you have this cancer with this problem? And then almost everybody says yes, because I had something in my life that was creating a lot of stress to me, a lot of pressure, and I was in a situation I wanted to die very often.
Okay.
And for example, with breast cancer, I found out that almost always they had a conflict with the partner.
Okay.
A couple of years before, 1.5, 2 years before the outbreak of the cancer, the partner left the woman, the partner died, partner betrayed the woman. This is one aspect, and the other aspect was in the early childhood with the mother. So these two conflicts can create breast cancer. Depends on the person, how the person acts with this problem, with this trauma. But this is, you can really ask almost every breast cancer patient, and she will tell you a story like this.
Okay.
And so if oncologists say the cancer has nothing to do with the psyche, for me it's completely ridiculous.
Okay, okay. So how do you connect this system of information and disease formation? Is there a theory behind it that you sort of believe in? How does that work?
No, my approach was, what can I do with this information?
Okay.
How can I treat this information? This is, for me, is interesting. I have the patient, and I thought, okay, there is a negative information, trauma inside this patient. How can I deal with it? What can I do against it? So I tried. The first thing is to find this inner pattern in the patient, and so I tried a lot of things, and I came to hypnosis, because hypnosis is a tool to go deeper inside the patient. So sometimes a patient say, oh yes, maybe it has to do with this, maybe it has to do with that, I don't know, my mother, my father, the work, whatever. There are a lot of problems, so how to find out what specifically creates a disease. And so I had the idea of a visualization method. I call it the sculpture visualization. So in hypnosis, the patient goes into a house. It's a house, it's called House of Disease. It's the inner house.
Okay.
It's not actually there. And the patient knows that in that house there is a sculpture. And this sculpture brings him or her into contact with the inner reason, the inner pattern of his or her disease. So, and I tried it more than 20 years ago, and actually the patient went into this inner house and said, oh yeah, there is a sculpture, it's a woman, it's a man, it's an animal, it's an abstract thing. whatever comes into your mind.
Okay.
Can be that specific sculpture. It's highly symbolic. Okay. And then the idea was by touching the sculpture to get in touch, in contact with the inner theme, with the inner subject. And it's actually one of my first patients. She went into that house and there was a sculpture, it was a man standing there. No, it was Mary. Saint Mary, it was Saint Mary, Holy Mary. And then by touching that, she cried, really burst out into tears. It was extreme, and that would the matter. And then I remember my father, when my father died. I was there. It was a very sad story, and I tried to suppress it. And then it came out. So, and then I found out, okay, I can, so to say, go into the center of the drama, but what to do with the drama? And first I thought, okay, only seeing, only finding out what the drama is will help, but it wasn't helping at all. And then I learned I had to go into the past. And then I said, okay, count to 10, for example. I want to 3, 4, and so on. And by the number of 10, you are in that very center, in the time where this problem was created. And then they say, oh, I'm in the early childhood. I'm looking for my mother, but my mother isn't there. It's a very, very common trauma for the patient, for the cancer patients. And then I tried to recreate to this situation in the past. Like you have a sheet of paper or a computer program, a Word document, and you write different things in that. So you can call your mother and say, please call your mother. She's not there. Try to call her, and she isn't coming. So who could help you? And then my brother can help me. And then, so ask your brother. He should fetch your mother, and then the brother fetches the mother, for example. So I tried to rewrite the past.
Okay, so you do that physically? Do you, if there is a conflict with the mother, you try to bring the mother physically in the life, or
only in hypnosis?
Only in your consciousness,
yes.
in your okay, all right.
It's like sometimes I do it like this: that I say, now your mother enters the room, and he comes next to where does she stand, and then the patient shows me. She's here, he's very close, and then we can act with that. So I tried to find a solution for this inner conflict, for this inner trauma, and the patient says in that very moment, says, now we have found the solution, and he's extremely relieved about it.
Okay, it's relieving to release
and
conflicts.
This solution, I try to anchor it. It's called in this process, we name it anchor. So to store this positive feeling in the body of the patient, and he has to exercise it every day. So this is more or less how I work with my hypnosis therapy with my technique.
Okay. So this is hypnosis is one way you work with this. You also mentioned, I found this really interesting when you said information from the outside can also cause disease in your body. So you also said a little bit about what you eat and whether you're harming the planet by what you're eating. If you're eating tortured animals, this also somehow causes disease. So I want to know your idea behind this concept.
I mean, there is this in diseases there are always a specific trauma in my experience, but then we have to think about it. Why are we here in the world?
Right.
So, are we here to earn money, to destroy our environment, or are we here to do something to improve ourselves, to become better people, to learn something? And therefore, for me, the focus should be respecting other people, learning, studying. For me, the main field of art is extremely important. Music, painting, sculpture, literature, everything, learning. So this is it's a healthy approach. I think every human being wants to develop him or herself into a more sufficient, more loving, more knowing being. And if you don't do that, if you refuse to go ahead in that direction, that can create diseases, in my view.
Okay.
If you live against your inner intentions, if you're doing jobs you don't supposed to do, boring jobs or whatever.
Yes. So you think one needs to find the inner purpose and follow that in order to also to stay healthy. So I personally find this question very interesting, because when we talk about finding the inner purpose, what's my purpose in life, it's very easy to say that, but we learn a job, we go to school, we pursue a medical career, and we think, okay, this is the purpose of my life. What do you think is the best way for people to find out the actual purpose of their life? What makes them truly happy? Do you have any tips or suggestions on that?
First of all, to be curious.
To be curious.
Yes, and then to try things. To try things. Going into a museum, for example, going into a concert, in a classical concert, even if classical music sounds very strange in the beginning, is there something what could be interesting? To read something what is not out of the normal, something more interesting. So I think trying to learn things, trying to learn a new language, for example. This is easy. You don't have to change your job.
Right.
But you can read a book. It's easy.
Yeah.
Trying things. And then find out, is it good for me or not? How does it feel like?
Okay. So you try out different things to see what makes you really tick, right? What makes you happy, and then in that direction you can find your true meaning and purpose in life.
Yeah.
Okay.
And to deal with other persons.
Yes, other people.
Yeah, with other people. How do you? What do I create in other person? What? For me, it's a very important thing as a physician. So for me, it's a sheer coincidence that I'm the physician and the other person is the patient.
Right.
It could be the other way around.
Right.
So, and what would I expect if I was the patient?
The patient, yeah.
So I would be that the physician would respect me, for example, that he wouldn't think about only money. How much money can I create out of this person?
Yeah.
So this is always, I try to, in my fantasy, I always switch positions. And then you have more or less a brother or sister sitting in front of you.
Right.
So.
You're right. Absolutely. So this is very fascinating. I could go on asking you forever in this direction. I will ask one more question in this direction, which is how the body-mind concept, how it's all connected. in staying healthy, right? It's important, you said, to try out new things, to treat everyone and everything with kindness. And if on top of that, if you were to give one advice and one tip for the body-mind connection, for the whole holistic approach of being healthy, if you were to give us one tip, what would that be?
Exercising.
Exercising.
Okay.
Okay. So
unfortunately, it's very important.
You are very, very strict on the importance of
We know that.
exercise. We know
We know that from studies.
That's one thing we know for sure.
Yes.
Right. Okay. So I will ask one question with regards to exercise. There is also some idea. Some practicing physicians and some theories that over-exercising is not good. There are athletes who do over-exercising, young people who are over-exercising themselves. So what do you think is a healthy dose of exercise for healthy people?
We know it for breast cancer patients that there are, for example, try to jog, if they're jogging, 2 to 3 hours per week.
2 to 3 hours per week.
Or 1 hour walking per day.
Okay, for people who have had cancer, right?
For breast cancer patients. So we know it from that group.
From that group. Okay.
So, but for a normal healthy being, for me it's not a strict rule that you have to do 2 hours or something. So just exercise more. Don't take the bus or go by foot, for example. Take the bicycle.
Right.
So it would be. It's easy.
It's easy. Yeah. It's also good for the environment, right?
Yeah.
Yes.
Don't take the elevator. Take the stairs, for example.
Okay.
You can use it every day. It's very easy to exercise.
How often do you exercise?
In that way, every day.
Every day. Okay.
Every day. But I also go bicycling, jogging, swimming. So
yeah.
I try to do a lot.
Okay. That's amazing.
If I want to go from my practice into the center of the city, I could use the train, for example. It would take 6 minutes to the center. If I go by foot, I need 20 minutes. So I very often go by foot.
Okay.
And I see very interesting things. And then I created a form of walking. I call it spiritual walking.
Okay.
So everybody says you have to live in the very moment.
Yeah.
But how to do it? It's very complicated normally.
Yeah.
So if I want to leave my practice into the center of Munich, for example.
Okay.
So I could go very straight, the shortest way possible, or I do it otherwise. I leave my practice, and then I say, should I go left or right? And I look around and see beautiful things, for example, or ugly things.
Okay.
Then I go in the direction of the beautiful thing. For example, a huge tree, for example, flower or something. And by going this from one intersection to the other, always choosing the beautiful things, you create a beautiful atmosphere. You always live in the very moment, because you have no time to think about past and future.
Right.
You always think, "Wow, this is beautiful. I go in that direction." Therefore, I call it spiritual walking.
That's amazing. That's a very beautiful concept. Yeah. Absolutely. So so this is really fascinating, the stuff we're talking about. So let's move a little bit to because in Ask a Neurologist we are very interested. The Ask a Neurologist podcast is a lot to do with brain health, how to stay healthy in your, how to also mental health. We talked a little bit about mental health, but I will focus a little bit here now on lifestyle and also what you can do to make sure your brain as it ages, it stays healthy. Tell us from your perspective of natural medicine and your life and practice.
So I think if you use an organ, it's better than if you don't use it. So that means if you learn something, it's good for your brain.
Okay.
So we know that if a patient suffers from dementia, for example, it tends to be later if he was an interested man or woman before. If he tried to learn something, if he knew languages, for example, it prolongs the period to the outbreak of the dementia, for example. So this is for me very, very important. Then exercising as well.
Yeah.
So we need, if you exercise, if you move our body, then we move our brain as well, our thinking as well. So we are becoming more flexible in this way. Then there are things, if you already develop the first symptoms of dementia, for example, of Alzheimer's disease. There is one very interesting theory that it's a kind of diabetes of the brain, because the brain needs a lot of sugar. And also in the brain there are insulin receptors. We know it now, 20 years before we didn't know it. It was claimed there were no insulin receptors, but now we know there are specific insulin receptors in the brain. And then by a high intake of carbohydrates, the receptors are becoming more and more weak. So it's like diabetes of the body. And then, of course, the brain cells, they are crying for sugar, but they cannot get
into the cells
the necessary amount of sugar, of glucose. So what is this brain cell doing, or the brain doing, to try to use the proteins of the brain to create sugar?
The structural proteins of the brain. Okay.
So this is one theory, and by that you destroy the brain. But it doesn't help, because the glucose that is created by destroying the proteins cannot go into the brain cell. Because of a lack of insulin. And you see a lot of elderly people, for example, they have a really hunger for sugar. When my mother was in a senior's residence before she died, she said on the dessert they put 3 spoons of sugar. And the dessert was extremely sweet. On the sugar, on the cake, 3 spoons of sugar as well. So because the brain needs sugar and cannot get sugar. So how do you deal with that? And this is a very interesting thing, because there are kinds of sugar that goes into cells without insulin. And this one sugar is galactose. Galactose is the half of lactose. Lactose is the milk sugar. So normally it's split apart in the bowels into glucose and galactose. And galactose would go theoretically in the brain, but there are many human beings that have a lack of the enzyme that split the lactose apart. So lactase is called the enzyme.
The lactose intolerance.
Yes. So for this patient, you can, for example, give galactose as a diet. They can sweet their coffee or whatever, like with galactose. That would be a healthy sugar. The other way is to eat middle chain fatty acids, like coconut oil, for example. This coconut oil or the middle chain fatty acids in general are turned into ketone bodies. And the brain can use ketone bodies as an energy source. There's a very famous case of a patient in the United States with Alzheimer's disease. And he was in a terrible state and was treated by his wife. She's a physician with coconut oil, with a high intake of coconut oil.
Okay.
And he improved a lot. She wrote a book about that. It's very interesting. So I try to use these things in my practice, and of course exercise.
Yes.
It's always the same
Can't
story.
express enough the importance of exercise. Yeah. Okay, this is very fascinating. So the different sources of energy, it can come from galactose, it can come from medium chain fatty acids. So do you in general suggest a low carbohydrate diet would be good for the brain, so that to prevent this kind of, as you said, the diabetes of the brain?
So as I said before, you cannot split apart how much you are doing during the day.
Yeah.
If you're working with your body, heavily body work, for example, you can eat carbohydrates. You can eat a lot of carbohydrates.
Okay.
But if you're just sitting around, so your intake of food should be low in general.
Yeah.
And then I don't know if I'm not so convinced, as I told you, of about ketogenic diet. Ketogenic means a very low input of carbohydrates. Okay. But it would be very helpful to get away from, to stop the intake of too much carbohydrates. So many. For example, we have learned in the last couple of years, that it's not necessary to eat every 2 hours something. That fasting during the day would be helpful. That you don't have to eat breakfast, you don't have to have lunch if you don't like it. So you can fasting during the day. Also that will reduce the insulin level by skipping meals. So this is a very interesting field. It seems to be that it can reduce the risk of breast cancer. At least one study, it shows that if the women are skipping the breakfast, they tend to get less breast cancer, for example.
Okay, that's very interesting.
That would be more helpful than eat tons of meat. Yeah. To create a ketogenic diet.
On the point of this galactose, the other type of sugar which is independently of insulin being taken up into the brain and can be used by the brain as a source of energy. So it mainly comes from milk-based food, right? Dairy food.
Yes.
So is dairy food, according to you, healthy in general?
Depends on the patient.
Depends on the
human being.
How about healthy individuals? Healthy people?
In general, I cannot tell that because, as I told you, I don't know if I mentioned it. 75% of the humans cannot tolerate dairy products.
Okay, dairy products, yes. Intolerance against dairy products,
so
right?
There are a lot of persons. So so I cannot say it in general, but there are people that can stomach milk products very good, and it's easier to for example, to use fermented milk products like yogurt, for example.
Why is that so? Why is fermented better?
They are pre-digested in a way.
Okay.
So it's easier to take them. And part of the sugar is turned into milky acid, for example, due to the fermentation process.
Okay. Right. Okay. And how about for those people who are lactose intolerant, if they want to use galactose as a source of energy, the other type of sugar? You said that you can buy galactose, it's available in that form. Is it's I know you were talking about patients, you can give it to patients, but is it also okay if a healthy individual says, okay, I want to try a different source of energy, I will want to buy galactose and eat it like that? What do you think about that?
I wouldn't recommend it.
Yeah, okay.
Because for me, it's the natural food is for me important.
Important, okay.
Yeah. Natural things, local things,
Yeah.
A lot of vegetables,
Yeah.
Fruits, fresh fruit.
Yeah.
So I don't like to eat things that are too alterated by industrial settings, processes.
Yeah. Okay, okay. I can totally
It's my
It's
philosophy.
your preference. Yeah. I can totally understand that. I have a question here which has to do with mental health, about depression, because we live in a society where everybody is required to do a lot of work, a lot of pressure for success, and so in this kind of a setting, what kind of a lifestyle or what tips would you give to prevent mental conditions like depression?
So I think also with depression there must be a specific inner trauma, a specific subject that you cannot overcome with lifestyle changes or something. Okay. You have to find it to treat it. So, for example, with hypnosis or things like that. Because in my view, there is always a connection between some incident in the past with the depression, for example. And normally you can find it. But there are other reasons for depressions, more in general terms, like hormone disbalances. It's a very important thing. I mean, if somebody suffers from a low thyroid hormone, for example, he gets depressed, or she gets depressed. The estrogen level is very important. If it goes down, for example, it can create depression. But there are other reasons. But if there are no obvious other reasons from the outside, from hormonal sphere, for example, there must be something inside this person which comes from the past, at least my theory.
From the psyche, okay. Yeah. So then you have to intervene with therapies such as hypnotherapy. Yes. Other than hypnotherapy, any other tip that can help?
Exercising as well.
Exercising as well.
There are studies with depression.
Right.
It's actually like this. It's not so easy to get a depressed man into exercising. Right. So you have to put a lot of stimuli. Okay. But it works. We know that it works.
In context of this depression and mental conditions, so we talked about many substances that you use in therapy of cancer and in the diseases that you treat. How about in treating mental conditions? Do you use any kinds of natural medication that helps in this field?
Mental conditions like depression?
For example, depression. Yeah.
The one thing is hypnosis, as I told you. The other thing is to give natural hormones. For example, progesterone, estrogen, testosterone could be helpful in these patients.
So do you substitute these hormones?
Yes.
Okay. Do you substitute them from a natural source, or for example, using which natural element?
No, they are derived from natural sources, from soy products, for example, but turned into the actual hormone, into, for example, progesterone. It's derived from the soy plant, but in the laboratory it can be easily turned into progesterone. So then I use progesterone.
Okay, okay.
It's identical to nature, so it's more helpful as giving soy plant remedy or the yam's root, for example. The yam's root comes very close to the progesterone, but it is not progesterone. So in this case, I prefer the actual
progesterone,
natural-like substance.
Okay, okay. So is there any problem area to using hormones as a therapy to treat mental illnesses? Because hormone substitution is often related to lots of side effects, people getting I don't know, other effects from hormones. How do you see that?
20, 30 years ago, they used artificial hormones, for example, estrogen out of a horse urine. Of course, if you use this estrogen, it does a lot of positive things, of course, but a lot of side effects. So. And we know from the studies that actually breast cancer, for example, was created. With the artificial hormones, but with the natural hormones, you cannot see this. You normally have no side effects at all. The first thing that goes down, for example, in women are the progesterone, and then they
in menopause.
Before with 35 years, it starts the decline of progesterone starts, and then this woman is more. They had mood swings, for example. They're irritated. The stress level is too high for her, and by giving progesterone, everything gets better. It can save families. And with men, it's the same thing. We men also have progesterone, for example.
Also progesterone. It will not be rather testosterone that's
we all have
causing imbalance.
Women and men have all progesterone, testosterone, estrogen. If you have a woman, for example, with a very low testosterone level, they don't want to have sex, for example.
That's very, very, very interesting. So when we're dealing with mental problems such as depression, so this could be one problem, that the hormonal imbalances. So do you measure the hormone levels in the blood and compare them to the norm variation in that age group, and then you substitute it to level it, right?
Yes.
Okay. And is it common for individuals to be experiencing this kind of mood swings and depression because of hormonal imbalances?
Yes, it's common for our society. I think if we lived in a different society with more, stable relationships, better work, better conditions. So I think it would be different. But in our terms, in our time, it's a huge problem. You get a lot of pressure in your work, for example. The stress is very high, and then the progesterone goes down. It's very typical because the progesterone is turned into a stress hormone in cortisol. The progesterone is used by the body to create cortisol. So it goes down. Then you can do two things: reduce the stress level, which is sometimes complicated, but important, of course. Meditation, to change something in your work-life balance, for example, and to give progesterone.
Okay.
As long as it's needed.
Okay, that's absolutely fascinating. Right. So I have also many other questions in my head, but for the interest of time, I will ask you one last question before we end this very interesting and fascinating conversation. If you are to give, okay, I know what you're going to answer to that, exercise, but other than exercise, what is you have so many years of experience in working with patients and with patients with serious conditions, but also patients who are generally healthy. For improvement of life situations, for people to truly live a happy and satisfied life and to stay healthy, give us some of the best lessons that you have learned in so many years of medical practice. Except for exercise, because we have already...
To create stable relationships.
Okay.
It's very important. So.
Okay.
From my own background, I found out if you're in a relationship, you always have to think about the other person. Mm-hmm. What are you doing with that person? Are you on the same way? Are you developing in different directions, for example? So I think human beings normally live in some relationships somehow. Are this relationship a good relationship? Can I do something to improve it? It's very important. And sometimes it's too late. You create it without knowing, without wanting a situation, and then the relationship breaks apart, and everything ends up in misery.
Yes.
You always watch out to see, to feel what is the need of the other person that is close to you.
Right.
This is important.
This is important. Okay. That's a very valuable life lesson. I thank you so much for all the wonderful things that we could learn from this conversation with you. I really appreciate for you taking the time to come here to our studio and having this conversation with us. We learned a lot of things. So I hope to see you maybe in the future in another follow-up episode of Ask a Neurologist. That would be wonderful.
You're very welcome.
Thank you very much. So that was Dr. Reinhard Probst telling us many useful information in how to live a happy and healthy life, and how to prevent cancer, and how to prevent mental illness, and how to stay healthy. So if you have found this episode interesting and useful, please leave a comment, share the episode with your friends, and I hope to see you in the next episode of Ask a Neurologist. Thank you.